Hello everyone, it's Vikrant Bhardwaj, Dr. Vikrant Bhardwaj from Physiorevive, and today on Insta Live we're going to discuss about on a topic of how physiotherapy can change your lifestyle, or in other word, if I say it's not only the lifestyle, I would say how physiotherapy can change your quality of life, which is very important. So if I talk about, there are two things, one is physiotherapy and one is your quality of life or lifestyle. Let's talk about a little bit about lifestyle first, or a quality of life first. So if we talk about quality of life or lifestyle, there are 3-4 components which comes under to this. The first would be your physical well-being, your mental well-being, obviously your social and financial well-being. Everything is correlated and interrelated. So quality of life, if I say, it would be, how you feel while living your life, how easily can you do your daily activities of living, means your daily routine work, how well you can perform in your office or in your work or in your profession. Is your physical well-being is affecting you to perform? So in a way, every component is very important. Now if we go to the first component, that would be your physical well-being. So physical well-being means, if I talk about, if you're suffering from low back pain or knee pain and your job requires to sit in front of a system for a very long time, so you'll not be able to perform very well in your job or in your profession, and it may hamper you to excel yourself. So ultimately the quality of life is affected, and the pain, the agony, the suffering which you're going through, which is holding you back to proceed further, is going up exponentially. There comes the role of physiotherapy. So for those people, I'm sure everyone in this society, or the people who are listening to us, they must be aware what physiotherapy is. Physiotherapy is a branch of modern medicine which deals with musculoskeletal condition or disabilities or pain or different issues of human being with physical means. Now physical means without medicine. So we treat people, we give treatment to people for their problems, whether it is of musculoskeletal, means related with muscles, spine, bone, joints, ligaments, or higher functions like mental well-being, that involves balance, coordination, tremors, Parkinson's, and different kind of aspects which touches everybody's life. Okay, so in physiotherapy there are different branches. One part is electrotherapy, like we treat people's condition through machines and modalities. Then there is one more part which is called manual therapy, where we induce certain techniques which involves the restoration of the function of the person who's suffering from some condition, whether it is pain or disability or some musculoskeletal issues. Then comes very specific fields like orthopedics, sports physiotherapy, which deals with sports injuries. Then comes gynae and obs, again a very important field where we have a very important role to play, how a female goes through the pregnancy period and how she recuperates after the delivery. Women's health, again it's a very interesting field where we deal with the elderly females who are suffering and going through the troubles. The other field which is very important after the COVID-19 pandemic would be the cardiopulmonary. That means that field of physiotherapy deals with chest conditions or post-cardiac conditions like CABG, like bypass surgeries and other cardiac conditions. So in toto, if I talk about, physiotherapy has become a very vast field now, and it touches everybody's life. So if I come back to today's topic, that is the role of physiotherapy to improve your lifestyle or to improve your quality of life, holds very much importance. So you can easily understand, if I'll give you one small example, like if somebody who's work from home. Because of the pandemic culture, it has grown up a lot. People have started using digital equipments like laptops, tabs, phone to connect and to take classes or to even work online. That involves lots of sitting, and lots of sitting means some problems which may come, whether it is related with your neck, whether it is related with your back, or whether it is related with your shoulder. So physiotherapy deals with all these things. So what is important first is the recognition. What exactly is the problem? That comes, the diagnosis of the condition or the problem. So suppose if you're suffering from some problem like pain or inability to do some work, first thing is you have to look for somebody who's specialized, to whom you should go for. Like if any pain which persists more than 24 to 48 hours, it's not subsiding, that means you need to consult somebody who's a professional. It can be any different profession. It can be your physician, or we do get regular direct referrals from the people. Like somebody who got a neck strain or back strain, they come straight to physiotherapists. They look for professional people, good people who are doing good work with good experience, and they can manage their condition without medicines. That is one part. The other part, which is holding now very much importance, is to make you comply certain exercise and do's and don'ts, and to change your way of working so that the similar problem should not happen in future. So the exact word is called prehabilitation, means before getting into a trouble which is going to come in next couple of months or years, if we can recognize and we can correct that, so that would be more of preventive care, which is nowadays very much catching up, because people are getting more and more aware about their health. People want to excel physically in their health, as they do want to grow financially and professionally. And as I said, what approach we are following is biopsychosocial approach, where everything is patient centric and patient has to participate in the treatment. For example, if we treat only your condition, it is not going to work for long. So you must have experienced this thing in your life, or some of your relatives, that if they're suffering from whether back pain or any other condition, they keep getting that problem in next 3 months, 6 months, 1 year, and they keep going, to physios or to physicians, or they try their self-medication. Why that happens? One of the reasons is the condition was not very well diagnosed, and patient was not involved in the treatment actively. That means the patient was just getting a treatment. He was not assured that unless and until he will make some fundamental changes in his lifestyle, like do's and don'ts, which he has to follow or she has to follow. If he or she will not do that, it would be very difficult to have a long-term relief. So now the concept is changing. We tell our patients, whoever, or the clients who comes, and we tell them it's a 50-50 thing. 50% role in treating any condition would be the patient's role. So patient is being made aware, like what condition is he or she suffering from, why this happened, so that a person should be counseled, so that he or she should not repeat the same sort of a behavior. For example, if somebody has a tendency to, watch OTTs or do work from home by doing half lying, half sitting on the bed instead of a chair because of the comfort, then they are going to suffer. So if we just not only treat the condition, the pain and the back issues, but also to modify the behavior of the patient by doing a counseling in our treatment, this is what we do, so that patient should be aware about what wrong he is doing or she is doing, and he or she can rectify, and ultimately it would be for the better compliance of the patient. Patient is not going to have a relapses of the same problem, and it will overall reduce the burden on the healthcare sector also, and the finances also. A person can perform better. For example, in an office, if there are 100 employees and 15 to 20% of the people are suffering from neck or back issues, the performance or the turnover of the company definitely is going to be affected. So nowadays what is happening, people are getting aware, and even the big corporate companies, they are involving good experienced physios who can do some sort of an assessment and scanning for the future issues, like if somebody is going to suffer back pain or neck pain in next coming 1 or 2 years. So preventive care is going to be the key to manage all these conditions. So as I said, the quality of life is definitely needs to be improved, or it should be, one should feel that I am feeling fine, I'm able to do my work, and my physical and mental well-being is not holding me back to excel, to grow, to able to achieve what I want to do. So that's why physiotherapy has a very important role to play in modifying or improving your quality of life or lifestyle. And it will be mutual, like it will be a kind of a teamwork between a patient and a good therapist. So with that note, I would be happy to have questions from the audience who wants to ask something, who wants that we should clarify something. Any questions from your end would be, a sort of an enlightenment for rest of the people. Any specific question regarding the same? So in my view, I would advise a person should be aware about his or her goals. Like goals means that some short-term goals and the long-term goals. Like if you're working somewhere, what exactly you want to achieve. Is your physical well-being or physical current condition is holding you to achieve that? If it is, for example, because of the back issues, neck issues, or your knee issues, shoulder issues, a constant nagging pain which is troubling you and holding you back, so in that case definitely you should consult somebody, and you can reach to a good therapist, and we will definitely going to sort that out. Right. So, okay. I got a first question. Can we connect to a physiotherapist for mobility issue? It's a very good question. Let me tell you one thing. All across the world, when the role comes of making somebody mobile or mobilized, especially in context of human being, physiotherapist is one of the most important person of the team of the rehabilitation. Yes, you should connect to a physiotherapist for the mobility issue, because mobility is something, it could be related with the current muscle weakness, it could be related to some higher center issues like related with the neurological condition, for example with the brain. I'll give you a specific example, like in Parkinson's, people have tremors, the old people, they can't walk much because there is a specific hormone, there is a specific neurotransmitter, we call it dopamine, that decreases with the age and certain conditions. So in those conditions, a physiotherapist has a very major role to play. I'll give you some other example. For example, if somebody met some sort of a road traffic accident where there was a head trauma, severe deterioration of neurological condition, in that case also physiotherapist has a role to play. Or for example, somebody got some fracture and is unable to walk, or somebody has gone for some elective surgeries like knee replacement, hip replacement, spine surgeries. In those cases, physiotherapist has a very important role to play, because physiotherapist will make the patient mobilize or to be mobile. So it's a movement therapy, we call it. The movement function improves with good quality of exercises. What exactly is the diagnosis? So it's a whole bunch of things which a physio will do. So it's very important. Very, very good question somebody has asked about, can we connect to a physiotherapist for mobility issue? And mobility is having basically two components. One is the local component, which is your muscle and joints and ligaments, and the local area, for example around knee. And the second component is the central part, which is the brain basically. So it should be synchronized, and we have to restore functions if it is related with the musculoskeletal condition or the neurological condition. So good question. Any other question if somebody wants to ask about the same, like any issue, pain, musculoskeletal issues or neurological conditions, that would be good so that everybody can be enlightened. Let me just go through if anybody has asked any other questions, right? Okay. Yeah, thank you so much for asking that question. Okay, we got a question from one of the audience, Mr. Hari. He's asking, are physical therapy and physiotherapy the same? Okay, it's a good question. It is actually same. So physical therapy and physiotherapy, the word physio is, is the one which was used initially. But as the whole world evolved, so we are going to be very specific. So in US and in some Western countries like Canada or in some European countries, instead of using a term physiotherapy, they use physical therapy. So it's basically the same thing. So there is no change in that. Physiotherapists are also called physical therapists all across the world. Many people used to have a mnemonic, a short name, so they called physios. So physios itself is very, popular, I would say, all across the world. In our country, we as follow most of the Britishers' English, so it's still that physiotherapy. And Britishers have a very important role to play in evolving the physiotherapy because it started basically from there only. Okay, somebody has asked, I actually had gone through a surgery and there is an implant in my leg, so it gives issues while walking. What should I do? Okay, it's again a very important question. So I would be interested to see that patient, because unless and until we see the patient and his history means what kind of surgery he has gone through, where he has gone through, what was the exact condition at the point of surgery, and how was the post-op rehab, which is also again a very important part. If somebody has done, maybe a surgeon has done his wonderful work, but if post-surgery he or she has not gone for a good physiotherapy, then definitely these issues does come. So in my view, I would suggest that you should you can contact us if you want, or you should reach to some good physios. And also very important, the surgeon who has operated you should keep that fellow also in the loop, because again, it's a teamwork between a surgeon, physio and the patient. So if everybody is playing their role completely, the chances are we will get 100% recovery. So definitely you should look for good physiotherapists and do share all the history of the surgery and everything. That's very important. Any other question do we have from the audience? Yes, let me just go through. Okay. What are physiotherapy modalities? Okay. So modalities means, I'll tell you, modalities are the machines or the kind of gadgets which we use in our treatment. So if I talk about last 50 or last 20 years, things have evolved so much. So initially 30-40 years back or 25-30 years back in our country, the physiotherapy used to means only one red bulb kind of a thing, infrared lamp, but now things have evolved from there. Initially there was short wave diathermy, which is a big machine which gives heat. Then came different other modalities like moist pack, hydrocollateral, right, and IFT, interferential therapy, ultrasound therapy. What came later was laser, which was very popular, or which is still very popular. Class 4 lasers are very important. They can treat the conditions where somebody needs even surgeries, and we can treat those conditions. Then the latest thing which came is shockwave therapy. No need to worry at all. It's not a shock giving machine. Shockwave is basically the wave being generated by the firing of the pellet. So it's a very very unique treatment, and it gives fantabulous result to the patient. So shockwave therapy is very, very latest thing. Then lots of combos basically, which is a combination of different frequencies of neuromuscular electrical stimulation which is there. So yes, things have definitely evolved and it's fast changing. Now what is coming now is virtual reality based modalities, where we are taking the patient or the client into a sort of a metaverse, and they are gonna see a total virtual different world. For example, somebody who has got hesitation in walking normally, we are trying to create an environment where a person is comfortable, and virtually by putting our glasses, VR glasses, and putting some sensors, we use artificial intelligence and other things which are very latest. So that is something very new. Okay, one more question is cardiopulmonary therapist is mandatory in cardiac surgeries, and do add a note on their scope? Very good question. Yes, ideally, if we talk about the developed countries, yes, they are the part of the team. And I would say, yes, it's a sort of a mandatory if they have a manpower. So if we talk about NHS, which is in UK, US or some European countries, yes, it is quite evolved. Now coming back to the context of our country, which is India, yes, things are definitely evolving. All big institutes, yes, they are recruiting cardiopulmonary therapists, and not from now. It is happening since many years. So yes, my suggestion is they should be recruited. And as far as somebody has asked about note on their scope, so let me tell you very frankly. See, we are not surgeons. We are not going to do surgeries. Our scope of practice is to make a person normal. I'm using a very normal, ordinary words so that everybody can understand. My job, or our as a physio job, is to make the person capable or able to do all those things which he or she was doing it before some episode of some injury or some issues like cardiac arrest or anything. So yes, they have a very important role to play for cardiovascular reconditioning, especially after any surgical procedure. Even in those cases where the surgery is not done and some condition is diagnosed, physiotherapy has a role to play. And if you say that, if you see in any hospital, it's very important role of a physio, especially in ICU and nurse, intensive care unit and HDU and CCU units. You will find physios are going there regularly. And in fact, nowadays, the trend has changed, like even the night duties have started. So it's a 24-hour kind of a care and expertise which are being provided to the patients, yes, in some good quality hospitals. And I'm sure in the coming time, it will be more and more frequent all across, whether it is a sort of a primary, secondary or tertiary care hospital. Tertiary care they already have. So hopefully soon these things evolve with the time as our country is progressing, especially the healthcare sector. So with the coming time, yes, it would be more frequent. All right. So do we have any more question? All right, doctor. All right. Anyone else? We still have 3 minutes. If somebody wants to ask a question, I'm here. We started 3 minutes late, so we can. I'm just going through whether I missed something. Okay. How can physiotherapy prevent surgery? Now, it's $1 million question. I would say, I'll give you a very small example. Like everybody knows that walking is good, or morning walk is good. Still, people suffers from heart attacks and other condition and obesity. It's again, everything has two roles to play. One is the curative, one is preventive. In preventive care, our emphasis is to avoid those problems which are going to come in future. So the first thing is definitely the right time assessment. In that case, we will be able to diagnose those early conditions, and we can stop a person from getting into the worst, and he or she may not require surgery. Now I'll give you an example as far as orthopedic conditions are concerned or sports conditions are concerned, that will make things very easy to understand. Yes, physiotherapy has a role to prevent surgery. For example, somebody has met an injury in the knee and his or her ACL, that is one ligament, anterior cruciate ligament, is got injured, right? And the injury, after scanning, we come to know that it is out of 5 grades, it is grade 2 injury. So grade 2 injury is, absolutely manageable even without surgery. And if we prepare the patient with good quality of exercise and rehab program, the chances are patient will never require the surgery. Now in other condition, the same person doesn't go for a physiotherapy, just carry on with the life, the chances are very high that there will be more degeneration, and the chances are someday that patient will get into a flared up situation where any sudden jerk will exaggerate that condition from grade 2 to grade 4 or complete rupture. So in that case, it will definitely change the whole scenario. So in my view, physiotherapy has capability and role to even prevent surgeries, but conditions apply. Not all conditions apply. Now somebody has asked, what is the importance of physiotherapy in our lifestyle? Yes, it is very important. As far as I'll ask from, you can ask from the audience or anybody. Everybody must have suffered in their life someday some sort of a back pain, neck pain, or a shoulder pain. So how do we manage that? There is a traditional approach which your friend or somebody will tell you, or you sometimes don't care if you're young, you say, okay, I'll be fine. The other way is you will consult somebody. If you're aware about that a physio can treat it, you will go straight. That's what we get. Most of the times we are getting patients straight coming to us first, not to even physicians or to anybody. Then our job is to diagnose, to basically assess the current condition and tell the patient what are the options. If we do need that, okay, somebody else has to be consulted, we do advise to the patient. So again, I'm coming back to the same statement. How the physiotherapy is going to change your lifestyle? It is going to change your lifestyle by making your life easy, by taking the pain out. So I'll say to my patients, like, freedom from pain, which we are providing to our patients, will definitely improve the scores in quality of life. So you'll be feeling better, you'll be feeling pain-free, you'll be able to do, right? So that's why physiotherapy has definitely role to play. Okay. Anyone else? Okay, I do. Okay. So I will conclude with one thing. See, God has given us one life. It is in our hand whether we suffer or we should live our life fully, and we should be able to achieve all those things which we want to achieve. Our physical, mental well-being is very much important. So first thing is prevention. You should avoid getting into those conditions where it may affect your quality of life, like bad posture, not exercising, obesity, overweight, and substance abuse. Example, these are the things which I wanted to mention. Then if that thing has happened, if some problem has happened like back pain, neck pain, shoulder pain, injuries or fractures, then it is very important to follow right treatment. Show to the right person, qualified person who's experienced enough, who should tell you what exactly you're suffering from, and who should involve you in the treatment part and take you to the path of recovery to achieve 100% success and all your desires and dreams for the future. So with that, okay, what is the difference between modern physiotherapy and classical physical therapy, physiotherapy? Okay, let's come back to, it's a good question somebody has asked. Modern physiotherapy is more evidence-based, means the researches which has happened in last couple of years has put light on many things. So modern physiotherapy is following the approach which I just mentioned, which is a patient-centric approach. So patient is in the center. Patient will be involved in the treatment. That means this is what I say to my patients, that you are the pilot of your plane. You have to you have to have a takeoff and landing nicely. For example, if I'm making my patient aware that maintaining right posture, doing right set of exercises will keep you problem free, then you have to do it, right? So this is important. That's the main difference between the classical physiotherapy and modern physiotherapy. Modern physiotherapy is giving more ear to the patient, and it is more equipped with more evidence-based approach, more latest things, more of exercise-based and manual therapy-based, where patient is in the center. So I would say the difference. One more question was, can physiotherapy reduce stress and anxiety? Yes, definitely. I can say somehow directly and somehow indirectly. For example, if somebody is going through the agony and pain and sufferings, unable to walk properly, or lots of pain while walking, that definitely is going to increase the stress. Other example, somebody is suffering from some injuries or some condition which is hampering him or her to go further. It will put unnecessary stress on the mind, that how will I cope up, whether I'll be able to walk comfortably or not, all these questions. So definitely it is going to increase the anxiety. And if we are treating that condition through physiotherapy, then basically we are reducing the stress and the anxiety. There are certain techniques which we use in our counseling, which we use in our treatment part, where patient feel much more comfortable. Those are called relaxation techniques, contrast relaxation and others. So it is very effective and very scientific. Yes, it is going to reduce the stress and anxiety directly and indirectly also. One more question which I just skipped was, okay, what is the difference? I believe manual therapy. Okay, right. Okay, so with the note, last note, as I was looking for any other question, it's already time up. So my take home message to everyone who were listening, whether a physio or a patient or anybody, a normal population, is try to be more aware about yourself. Try to be more aware about your physical and mental well-being. The time when you feel that there is an issue where you are not performing 100%, your body, your physical well-being or the mental well-being is holding you back, it's the time to consult somebody who's expert and sort your conditions out and live a very, very healthy and prosperous life, because health is everything and it is non-negotiable. You can't buy health. You have to have a good maintenance of yourself by mending your ways, by following certain do's and don'ts, by doing exercises, by consulting somebody who's professional and experienced. That's it. So with that, I will wish everybody good health and good well-being. So that's it. Goodbye from my side. Thank you so much.